Think you're doing your best to keep your heart healthy? You're not alone. Physicians, researchers, and scientists are constantly looking to find the best way to care for cardiac issues. And some suggest that what we've been doing in the past may not be perfect. Dr. Vilma Torres is here with an update. Dr. Torres' specialties are cardiovascular disease and cardiac electrophysiology at MetroHealth. Man, mouthful for me. And we know men and women have different symptoms for heart issues, but there is some common ground as to prevention and treatment, right?
Absolutely, absolutely correct. And I think it's very important to get back to the basics because cardiovascular medicine has exploded over the past decades. And the basics of lifestyle modification with diet and exercise, which is very difficult for many of us to do. But they're still the core of cardiovascular disease prevention. And there is a common ground of the use of cholesterol-lowering drugs known as statins, which work very well for both men and women.
Okay, how about an aspirin a day?
An aspirin a day is a very interesting issue. Aspirin has been around for many years. It is a drug that is an anti-inflammatory that many people take for headaches, but it has been used for cardiovascular disease prevention. It has been used for what we call primary prevention, and before someone has had a heart attack, or secondary prevention once a person has been established to have cardiovascular disease. But the studies have shown lately that an aspirin is not for everyone.
Oh, okay.
There is a lot of individuals who, let's say, for instance, have a friend who has a heart attack or drops dead, and there's the passion and the emotion associated with that. I said, I better take an aspirin because it's going to be good for me and prevent that from happening. And that is not necessarily so. We have learned that there's, just like there's potential benefits, there's potential risk. And the risk is the issues of bleeding. So the way that the scientific community and the cardiovascular community is trying to answer those questions is, what is your potential benefit with the potential risk? And assessing the bleeding risk, because that is the risk with aspirin. It is the risk of bleeding from an ulcer or having a hemorrhage in the brain if the blood pressure is excessively high. And so these are the things to look at.
So we talk about bleeding, that's blood thinning. You also deal with atrial fibrillation, there we go, and that can lead to a stroke, but anticoagulants are also an issue right now?
Yeah, anticoagulants are an issue, but, and I will go back to that, Lori, but I wanted to say something else about aspirin that is very important, and that is the issue of aspirin in diabetics. And the issue of aspirin in diabetics has been that it has been said that perhaps they don't really work as well. But this is actually one of the newer things, that there are some trials going on that suggest that maybe a diabetic person may need to have an aspirin twice a day, perhaps at a lower dose, because it doesn't work as well in those patients. So I'm not saying that diabetics need to go out there and take 2 aspirins a day, but that the data is research. Even though the drug has been around for a long time, there's really good research going on. Going back to the area of that is a passion for me, and that's been the subject of atrial fibrillation.
Well, we got to talk about it quickly, so.
It's very quickly. It's because I could go on forever because I love it so much. It is that atrial fibrillation is an irregular heart rhythm where the heart does not pump effectively. There could be blood clots that occur, and that can lead to a stroke. As a good friend of mine says, you can transfuse blood, but you cannot transfuse brain, because the brain is what is lost in a stroke. It cannot be replaced. And there's a lot of data out there about anticoagulation and the potential risk from drugs that are very good that can actually prevent a patient from having a stroke. And the misinformation.
Listen to your doctor, right?
Exactly. There is a lot of good information. It's learning about it and knowing that you may not be at risk, and not everybody has a terrible hemorrhage that they're going to die from, but that some of the anticoagulants can prevent a stroke.
All right. There are exciting treatments on the horizon for keeping our hearts healthy, while at the same time some typical treatments that may have been tried may not turn out to be true. Don't be confused. Just confirm with your cardiologist that the plan is perfect for you. My thanks to Dr. Torres for her heartfelt advice.
To learn more, call MetroHealth at 216-778-7800 or log on to www.metrohealth.org. Next.